You're listening to Health Professional Radio. My name is Wayne Bucklar, and joining me today is Gregg Chapman. Gregg's a clinical manager at Strategic Psychology in Canberra. Gregg, welcome to Health Professional Radio.
Thank you very much.
Now, Gregg, before we get on to the kind of product and services you do, can you give us an idea of what geographic footprint you service and maybe a sense of the size of the firm?
Yeah, certainly. Look, our practice Strategic Psychology services the ACT and the hinterland. We've had referrals from as far afield as Goulburn. We consider that just up the road. It's about an hour's fast drive, of course. Mm-hmm. The south coast of New South Wales, as far afield as Dubbo and Tumut. We employ 9 psychologists in total. That includes our managing director, Nash Nikolic, and myself as clinical manager, with some of our psychs working some evenings a week. And we also have 3 reception staff. We're anticipating taking on 2 more psychologists shortly, so the business is expanding.
It's always nice when a business is expanding.
True.
Gregg, give us a sense of the products and services, if you like. I know it's odd to talk about products in terms of a psychology practice, but I'm just trying to get a sense of what it is you do. And in particular, many of our audience are clinical staff of one kind or another. What's the message you'd like clinical staff and patients to know about the practice?
Well, Strategic Psychology, naturally enough, offers psychological therapy. That's fairly standard. We do psychological assessments. We do some training in acceptance and commitment therapy, which is our favourite therapy, and we do some consultancy advice. With my Masters in Human Resource Management, I also do some executive coaching from time to time. Mm-hmm. Our practice specialises, as I said, in that increasingly popular form of cognitive behaviour therapy, acceptance and commitment therapy. That was in part popularised by the best-selling book, The Happiness Trap by Russ Harris. Many of your listeners may have seen on the book stands or read. Mm-hmm. We also undertake rehabilitation work, national disability assessments, insurance claims and compensation work, and we have referrals from a number of private schools, solicitors and VVCS veterans counselling. And, of course, naturally, the GPs, paediatricians and psychiatrists refer to us. So we offer a range of therapy from an age where the client can sustain their focus and engage meaningfully, that is, talking about toddlers, and psychological assessments throughout the lifespan.
Now, I notice you mentioned paediatricians there, and it's one of our particular interests. What's the most common issue that strategic psychology deals with in the child and adolescent area, I guess?
By far and away, I suppose that would be behavioural disorders. Parents come into the wits' end seeking help from us, and that's by far usually associated with attention deficit hyperactivity disorder or attention deficit disorder, and the commonly accompanying comorbid disorder, oppositional defiant disorder. We also work a bit with teenage lack of engagement and motivation. Listeners may chuckle to hear that phrase. We're talking about beyond the standard teenage lack of engagement and motivation for some. And school refusals and dissatisfaction with schooling often feature for us as well.
Now, ADHD is an interesting topic. How is it identified?
Normally it's done by taking a history and looking at current reports from caregivers, administering semi-structured interviews or structured interviews, checklisting on the rating scales like the commonly known Brown ADD scales or the Vanderbilt system scales and the Connors rating scales, and of course our clinical observations. The symptoms and signs, as listeners would probably know, being a clinical audience, for ADD, ADHD are clustered into the 3 inattention, hyperactivity and impulsivity domains, and that generates 3 forms of the condition: that predominantly inattentive, predominantly hyperactive, impulsive, and are combined. And we try to move to a differential diagnosis to better guide our interventions where possible.
Now, in working with children and adolescents with ADHD, is there a particular, I guess, I don't know the right word, work philosophy, a clinical practice model that you follow?
Yes, we do. We offer advice on behaviour management and teaching strategies to the young person's school if they're willing to accept it. We offer parenting advice, naturally. That's a large component of our work. And we work with the referring GPs, paediatricians and other allied health professionals, like perhaps in some cases speech pathologists or occupational therapists where there are comorbid conditions there on a case-by-case basis. And in some cases we even offer individual primary therapy to the sufferer of the condition, the young child or adolescent. But our main focus is probably on training parenting skills.
You're listening to Health Professional Radio with Wayne Bucklar. I'm in conversation with Gregg Chapman, Clinical Manager at Strategic Psychology in Canberra in Australia, and we've been talking about the practices work with children and adolescents, and in particular with ADHD. Gregg, you mentioned there that you give advice to schools. How does that play out?
Fairly well, usually. Unfortunately, being a private practice, there are time and cost limits in terms of our travel and wait times at schools and foregoing sessions in the practice. But I'd like to do more in that area as a former school psychologist of many, dare I say, decades. Quite at home in schools. It's always enjoyable to revisit them and see what's going on. And I think we're probably perhaps a little unique in our efforts to liaise and work with the young client school to the extent we're trying, with the aim being to develop as consistent an approach as is possible across the context in which the child or the adolescent lives, the home and the school. We're finding both the parents and the school seem to appreciate the communication, and then later on, hopefully, collaboration and cooperation on management.
Have you formed a view, Gregg, given your time in schools and your history, about how schools can best cope with students with ADHD?
Yes, look, my thing is that, as listeners will probably be aware, there are many texts addressing this, most notably probably Russell Barkley in the US, the world international guru in the area. But essentially, I think it helps to accept for schools that ADHD is real. Sometimes we get a denial of the condition that it's just naughtiness or poor parenting. Thus, an understanding of the disorder and also understanding the uniqueness of the child and their context, because there's a saying in ASD, autistic spectrum disorder areas, when you've seen one child with autistic spectrum disorder, you've seen one child with autistic spectrum disorder. I think the same applies to ADHD to some extent. We want to encourage and support the child's strengths and to facilitate the reasonable adjustments that are required by law these days under the Disability Standards for Education Act in 2005. Now, in terms of therapeutic approaches to behaviour management, in my opinion, the reality therapy approach of the world-renowned US psychiatrist William Glasser, the work of Australian Professor Bill Rogers, be well known in schools, where it's possible to implement, and the applied behavioural analysis approach, which can be quite tricky to apply in schools, but sometimes can be applied with a willing and consistent teacher. So we're looking at also at the moment how acceptance and commitment therapy might apply to ADHD as well. We're working up a platform for doing that.
You have a very comprehensive view about that. It's nice to hear the experience coming forth when you're talking.
Oh, thank you. Yeah.
And tell us, we've been talking about the services that you have, and we've kind of strayed into children and adolescents to some extent. Gregg, tell us a little bit about what it is about your products and services you'd like clinical staff and patients to know about.
We have a mission statement, a corporate statement that says we listen, we understand, we care. I suppose that's quite a nice thing to put forward in all sincerity. In the Cognitive Behaviour Therapy School, our favourite form of therapy, acceptance and commitment therapy, is our therapy of choice and main therapy. And I think that it's nice for people to begin to understand this relatively newer form of therapy in Australia. It's actually been around about 30 years, but it's starting to penetrate here more in the last decade or so. We favour that because it has such an impressive empirical support base over many years. And since it's cognitive behaviour therapy, all the research supporting cognitive behaviour therapy also applies to acceptance and commitment therapy. But we tend to find that ACT tends to achieve more satisfying, stable and lasting results. That's been borne out in the literature as well, which is quite nice. We've got the empirical support there. We treat a very wide range of psychological and emotional challenges across most of the lifespan, as I said earlier. Our clinicians have undertaken the Level 1 Gottman Marriage and Relationship Counselling training, which is another world-renowned approach to relationships counselling. We're quite keen about expanding our use of that. Our team recently went on a course and undertook a 2-day course on that and found that very useful, and we're now implementing that with our clients. And we're finding initially quite a lot of success fairly rapidly. Very encouraging.
Interesting to hear. Gregg, In every interview, my favourite question always comes down to misconceptions. And in every field of endeavour, there are misconceptions. What's the biggest misconception about your products and services that keeps you awake at night?
Well, strategic psychology is always striving to be better. I think our staff all sleep well at night, particularly since I've done a qualification in sleep psychology. I'd be able to assist there, I suppose, if there were any problems. Look, we spend a lot of time analysing the quality of our processes and client satisfaction and the outcomes, and we're constantly striving to improve. Possibly the biggest misconception about our services is the notion of wanting difficulties fixed and fixed fast. There are some things that can't be changed. If the change is possible and functional, we can help our clients in this. The fact is there are also some things that can't be changed and that result in dysfunction and an actual worsening of the situation if change were attempted. The client attempts to struggle with the problem and thereby reinforces it and in actual fact makes it worse. But acceptance and commitment therapy, as I mentioned earlier, our favourite therapy, takes the view we ought to change that which is dysfunctional in terms of impeding our goals and living our values. Also, we have to learn to function as much as possible with those difficulties we have that are unchangeable and still live a rich, meaningful, enjoyable life in accordance with our values. In our culture, it's often expected that we can always be happy, not experience pain, living the good life. That's a common illusion, unfortunately, we struggle to work on. Now, we note here in the practice that in life, an old saying from the East, pain is inevitable, but suffering, no, that's optional.
Yes, very true. Gregg, it's been a pleasure having you with us on Health Professional Radio. I do appreciate you giving up your time today.
Thank you very much for contacting us and spending your time with us too.
It's been our pleasure. And listeners, if you've missed my conversation with Gregg Chapman, then you have missed a very interesting chat. Gregg, as I mentioned earlier, is the clinical manager at Strategic Psychology in Canberra. But the good news is we have a transcript of the interview on our website, or you can listen to the audio archive, which is available on both YouTube and SoundCloud, and you can find links to all of those resources at www.hpr.fm. If you'd like to get in touch with Gregg Chapman, the clinical manager at Strategic Psychology, you can visit the website. It's www.strategicpsychology, all one word, .com.au, or you can give the clinic a call 02 6262 6157. You're listening to Health Professional Radio. Thank you for being with us today. My name is Wayne Bucklar.